Territories and the Commonwealth. So in her place we have the Director General of Queensland Health, Dr. John Wakefield, who is available to answer your questions. In the last 24 hours we have seen 2 further cases of COVID-19 here in Queensland. The first is a woman in her 20s, a household contact of a known case. The second is a woman in her 30s, a healthcare worker at the Ipswich Hospital, a further healthcare worker at the Ipswich Hospital. That leaves us with 25 active cases in the state, 1,131 in total. In the last testing period, we completed more than 6,000 tests, 6,062. As we creep towards that 1 million test number, we're currently at 960,000 tests. I can also confirm that we have now tested 662 at the pop-up fever clinic on Russell Island, 510 of those in the last 24 hours. We expect that some of those test results, those negative test results that have come through, will have been from the first day of testing on Russell Island, so that's promising that we're not seeing positive results there just yet. I might let Dr. Wakefield make a statement, and then we're both available for questions.
Thank you, Deputy Premier. I won't repeat those numbers. Suffice to say that I'll use this opportunity to do 2 things. One is, again, to remind our community in the southeast corner where the hotspot is, and also around the state, that if you are sick, if you're unwell in any way, please stay home and get tested, and don't return to work or community life until you've had that result confirmed. Can I also say, through you, a very big thank you to my staff within Queensland Health. It's been a trying time, the last few weeks particularly. Whatever we've thrown at them by way of contact tracing, by way of mobilising clinics, by way of managing outbreaks in residential aged care, in youth justice, in corrections, and in a hospital, we continue to provide great services to the people of Queensland. And I'd like to acknowledge our everyday health heroes who put themselves in harm's way to do this each and every day. Thank you.
Can we just talk about the Ipswich Hospital for a second? So this woman in her 30s, where did she work in the COVID unit as well, or what was sort of?
So I don't have the detail of that. What I can say is that she was under a quarantine arrangement, and she was identified as a contact of that previous case. So in that way, we knew she was in a place of safety, if you like, in terms of her quarantine, and she was obviously subsequently found to be positive after that test.
I'm just wondering what the spread has been, and I use that loosely, but what the spread has been throughout the hospital. For example, we know that first nurse was in the COVID.
Yes.
Like, has it moved into more of the general, people working in the general areas, or that sort of thing?
So the answer is no. Basically, that so there are 5 staff now as part of that cluster in the Ipswich Hospital. They all either have arisen from working in that COVID area or from being a defined close contact of the nurses that were initially identified. So the link is direct. So Westmoreton have done an excellent job with the support of Children's Health Queensland and our other large health services. At this stage, the emergency department staff that had previously been under quarantine have all tested clear, and they're back at work, which helped a lot. Those staff that are now quarantined, it was necessary because of that large number, for Westmoreton to initiate the next stage of their internal plans. And the common sense approach to that is to shift staff from the surgical areas, the elective surgical areas, who know Ipswich Hospital, who know the place, to support the what we call the acute area of the hospital, that is emergency department and the acute admissions, medical admissions. And so all of those services are proceeding normally. Elective surgery, as a consequence, for the next few days has had to be reduced. and you would understand that that's just simple arithmetic. Obviously, our focus is on the patients who are affected by that, and two things have happened in respect of that. The first one is we've initiated our private hospital relationship, which we have across the state, including in Westmoreton, to be able to support those patients whose surgery has been cancelled or has had to be cancelled. These are not urgent cases, these are low priority electives, but each one of them is very important if you're the patient. In addition to that, I've mobilised over the weekend our other large health services surrounding Brisbane, particularly Metro South and Metro North, and the Children's and the MARTA, to be able to provide support to Westmoreton, but also to be ready should there be further cases and the need to quarantine more staff, that we can do that swiftly and in an organised way so that we maintain services for the people of Westmoreton. It's not fair, it would not be right for the patients of Westmoreton to suffer less access to services whilst our other health services are going full pelt on elective surgery.
So did you say that people whose surgeries have been cancelled will get that surgery now in the private?
Well, we do that case by case. It depends on the case. But what I am saying is that for every patient whose procedure is delayed, i.e. the surgery is cancelled that was scheduled this week, we work with them to decide, well, what do they want to do? What can we offer by way of private surgery? It depends what the operation is. I don't have that number at the moment. Again, you'll appreciate on the weekend they were working through an enormous amount. I'm happy to provide that as soon as we have it.
Mr. Miles, there has been concerns expressed by the AMA pharmacy users and workers about them doing tests. Is it safe for them to do? How much consultation have you done? How much training?
Look, I think what people know is that we wouldn't be trialling anything unless we thought it was safe. The Chief Health Officer has initiated this trial project. It will commence initially in a small number of pharmacies. It will be voluntary. It won't be advertised, so the idea won't be to drag people in. However, people are still going to pharmacies to get strepsils, to get cold and flu drugs, to get medications for the kinds of symptoms that we want to test for COVID-19. And so this is a chance for them to be told in the pharmacy, you should get a COVID-19 test, and we can offer that here for you now on the spot. That's all it is. There's nothing more to it than that. There are a range of organisations with their own interests making claims about what this trial is, but it is small scale, very safe, and designed to opportunistically test people with the symptoms that we want to test for COVID-19 who are there already.
Where will they be tested? What rooms will be selected?
Well, obviously, to be eligible to take part in the trial, the pharmacy will need to both have a space that is appropriate and staff that are trained appropriately, as well as access to the appropriate protective equipment. Obviously, pharmacies, there's a wide range of different pharmacy formats. Many of them have within their premises pathology collection locations already, and obviously they would lend themselves to an immediate referral from the request to that collection point. There are others that have different kinds of spaces that would be appropriate. Obviously, we're only going to allow those to participate where they choose to, where they volunteer, and where they have appropriate spaces. So I'd urge people to not get caught up in the hysteria of this. It's a simple measure based on the feedback we got from pharmacists that lots of people were still coming in for the kinds of medications you would use for the symptoms of COVID-19 and not getting tested for COVID-19. There'll be an arrangement in place to ensure that they're remunerated for the trial, yes.
Quarantine's about to wrap up for the people who are on board that Lady Panama boat. How many, or are any of those people who are on board planning to stay in Queensland? Will you be letting them stay under the new resident protocol?
Look, I'm not across the details of each individual, and I'd usually be hesitant to go to the details of each individual, but I'm happy to get you that detail. Obviously, there was a range of investigations, both health and police, both here and in other states, and so they're ongoing, as I understand it.
Do you understand if anyone's going to be sent back?
The Prime Minister praised New South Wales as having the gold standard in contact tracing and mitigation. Do you think New South Wales is
Well, I mean, there's different things you can look at to measure here. I think our contact tracers here in Queensland are the best in the nation. I think they've proven that. I think they're doing a really great job. It's not really a competition. I know Mr Morrison keeps trying to turn it into a competition between the Liberal-led states and the Labor-led states. I don't think that's fair. But if you want to look at the results, then look at the results. Look at the actual results. Look at the number of cases. Look at which states have been effective at reducing their number of cases. Look at which states have been most effective at keeping their economies moving. And on all of those measures, it's states like Queensland and WA that stand out. Scott Morrison might not like to acknowledge that, though. So look, there's 5,000 people in quarantine. I'm not across the detail of each and every one. I don't think you can expect me to be, but I'm happy to get a statement ready for you this afternoon. There's quite a few high-profile cases in there.
What's the situation with the lockdown at prison? Presumably it's been more than a fortnight now since the first cases in the prison. Where are things at in trying to reduce the lockdown there? Haven't we figured out whether or not people there have COVID yet?
I don't think we're yet at a fortnight since the last confirmed case was potentially infectious, but I'm happy to find out that for you, Alison. That would be the first threshold at which we would begin to de-escalate those lockdown restrictions. Clearly, Corrections is keen to do that as quickly as they possibly can. It will happen at different stages at different prisons, dependent on when they were potentially exposed. Again, it's a question better directed to the Corrective Services Commission, but obviously Janetta's working closely with them.
I appreciate we're not across all the different cases, but the Premier was quite strong with the language around those AFL players who meant to sort of kicked out of the state. How do you feel about these people that were on the way from who came into Queensland allegedly illegally? Do you think they should be allowed to stay here?
Well, look, I want to see the investigation happen. I want to see them fined if that's appropriate. I want to see them charged if that's appropriate. And they're the kinds of investigations that I understand are underway, but they're by and large police investigations and matters for police. Look, I'll find out what the plans are with regards to their quarantine. As I say, I'm happy to issue a statement. What we said at the time was very clearly that we did not want people trying to use creative ways to get around our travel restrictions. And if we have powers to enforce that, then we'll certainly look to use them.
Minister, any thoughts on
Well, I was very sad to hear that news this morning that Director General advised me early this morning. It was tragic to see Tim pass away. He was a great loss to the Labor Party, great loss to the state of Queensland. I know his loss will be particularly felt in Mackay. He was also a great loss to our health service. He was the chair of our Mackay Hospital and Health Service, and I know that as recently as Friday he was actively working with the health service doing that job right till the end. He refused to stop doing that job. I think it gave him a great sense of contribution, ongoing contribution to the Mackay community. It's incredibly tragic. I know our people are grieving today, and I'm sure Tim's people will be grieving today. I know that in caucus shortly we'll take a moment's silence to reflect on Tim's contribution. Well, it is true, Jess, that in 2012 the Newman government abolished the Patient Safety Unit in Queensland Health. It's something that I've done a lot of work on to rebuild. We passed new laws requiring transparency on both our hospitals and on private hospital facilities. Unfortunately, we had to delay the publication of that transparency data till next year, but it will include information across a wide range of patient safety measures, in particular hospital-acquired complications, which are deemed the best measure of quality and safety, the best thing for us to be looking at to determine how well our hospitals are going at reducing those complications. No, I don't have the detail of that. I don't expect it would be particularly expensive, and we want to do more testing. We've got testing capability, and we want to test people. Cost is really not the issue here.
What do you make of the president that said that they will blockade funds, etc. What do you say to that?
Well, I'd say, are they going to continue selling strepsils? Are they going to keep selling cold and flu drugs? I mean, these are people going into pharmacies to get treatments for symptoms that we know are symptoms of COVID-19 and not getting tested right now. This is a measure to see those people get tested. I don't think the views that have been quoted today reflect the views of pharmacists, because it is pharmacists who came to us who suggested to the Chief Health Officer that they could offer this as an additional service and that they would like to, because they know that they are asking people to go and get COVID tested and some of them are not. So, this wasn't our idea. This was brought to us by the pharmacy industry, considered by our Chief Health Officer. She has come up with a trial program that is safe and that will hopefully allow us to test more people with COVID-19 symptoms, which is what we're all about. I continue to discuss different options for pandemic leave in the health sector. As I've indicated to you before, Dominic, it's more complicated in health than elsewhere, but I'm sure we'll find an appropriate way to thank and recognise our health heroes. They really have been the heroes of 2020, and we want to make sure that they are properly recognised. Certainly we'd want to see that recognition before the end of the year, yeah. Thank you all.